It is 3 a.m. While the rest of the world is deep in dreamland, you are wide awake. Again. You drag yourself to the bathroom for the 4th time tonight. This frustrating cycle has completely ruined your sleep. You look in the mirror and ask, why is this happening? Well, the culprit is hiding right below your bladder. Meet the prostate gland. It sits just below the bladder, wrapping around the urethra, the tube that carries urine out. Normally, your prostate is the size of a walnut, about 20 to 30 cubic centimeters in volume. It's perfectly happy and well-behaved. But as men age, it tends to grow. Now, imagine that walnut swelling up to the size of a lemon, hitting 60 cubic centimeters. At 60 cubic centimeters, this bulky gland starts squeezing the urethra tight, blocking the flow. That is why you are waking up all night. So you visit your doctor. He confirms your prostate is 60 cubic centimeters, which is quite large. But then he hands you another test result. Your blood test shows an elevated PSA level. Instantly, panic sets in. Your mind jumps straight to the worst-case scenario, cancer. But hold on. Take a deep breath. A high PSA level does not automatically mean you have prostate cancer. What you likely have is called BPH, or benign prostatic hyperplasia. It is just a medical term for a swollen prostate. The most important word here is benign. This simply means the growth is completely non-cancerous. It is harmless in that regard. You breathe a sigh of relief, but you're still confused. If it is just benign swelling, why did the PSA level shoot up? That is an excellent question. To understand the connection between a 60 cubic centimeters prostate and high PSA, we need to look inside. What exactly is PSA? And why does a bigger prostate leak more of it into your bloodstream? Let's meet the little guys behind it. PSA stands for prostate-specific antigen. It is a specific type of protein produced almost exclusively by your prostate gland. Think of PSA as an army of tiny, dedicated factory workers living inside the microscopic tubes of your prostate. Their main job? To liquefy semen. They ensure reproductive fluids flow smoothly and function properly when needed. Normally, these workers stay strictly inside the prostate. A strong cellular barrier keeps them separated from your bloodstream. Because of this tight security, only a tiny fraction of PSA workers ever manage to slip into the blood vessel. But when your prostate balloons up to an abnormal 60 cubic centimeters, the entire biological landscape changes drastically. First, more prostate tissue simply means more PSA factories. It is a matter of basic mathematics. A 60 cubic centimeters prostate naturally produces about 3 times as much PSA as a healthy 20 cubic centimeters prostate, just by existing. Second, there is the pressure problem. A 60 cubic centimeters gland is packed extremely tight inside your pelvis, causing massive internal pressure. This constant internal squeezing physically stretches the microscopic cellular walls, making them thin and leaky. Suddenly, the once strong barrier has gaps. The PSA workers get literally squeezed out, falling through the cracks. They tumble out of the prostate tubes and splash directly into the surrounding blood vessels, flooding the bloodstream. So, when your doctor draws a blood sample, they find all these extra PSA workers floating around. This is exactly why a 60 cubic centimeters prostate inherently causes a high PSA level. It is a plumbing leak, not a tumor. But wait, size and pressure aren't the only things that cause PSA leaks. What else might be spiking your numbers? So we know size and pressure cause leaks. But let's look at 3 other everyday things that can spike your PSA. Number 1. Physical trauma to the area. And by trauma, I mean something as simple as going for a long bike ride. Sitting on a hard bicycle seat physically massages and jostles that 60 cubic centimeters prostate, literally squeezing out more PSA workers. It's like squishing a wet sponge. The workers are forced out into the blood, causing a temporary spike in your test results. So, doctors usually advise avoiding long bike rides for a few days before taking a PSA test. Number 2, inflammation or infection, commonly known as prostatitis or a severe UTI. If bacteria invade the prostate, the tissue becomes inflamed. It gets red, angry, and severely swollen. This inflammation absolutely wrecks the cellular barrier. The PSA workers evacuate the area like a building on fire. They flood straight into the bloodstream. In fact, an infection can skyrocket your PSA numbers way higher than cancer ever would. Once the infection is cleared with antibiotics, the PSA levels usually drop right back down. And number 3, well, it is actually a recent medical exam. Specifically, a digital rectal exam. Yes, the famous prostate check. While it is incredibly important for your health, the physical pressing of the gland acts just like the bicycle seat. The gentle poking pushes some of those PSA workers out into your blood. This is why blood tests for PSA are always drawn before the doctor performs the physical exam. So, when you see a high PSA number, remember, it is a marker of prostate activity, not exclusively a cancer alarm. You feel better, but a lingering doubt remains. But doctor, how do we absolutely know those leaked workers aren't from cancer? That is the million-dollar question. Cancer cells also leak PSA, but they do it a bit differently. We have a smarter way to check. We look deeper into your blood using a test called the free PSA ratio. Let's go back to the bloodstream. Some PSA workers from an enlarged prostate float around in your blood completely by themselves. We call this free PSA. Others get attached and locked onto other large blood proteins. They're essentially handcuffed. We call this bound PSA. Here is the medical secret. A benign 60 cubic centimeters prostate leaks mostly free workers. But cancer cells tend to produce bound workers. According to guidelines from institutions like the Mayo Clinic, the ratio between these two tells us a powerful story. If your free PSA percentage is high, usually over 25%, it strongly points to benign swelling, like your 60 cubic centimeters prostate. However, if the free percentage is very low, say under 10%, it raises a red flag for the doctor to investigate further. Investigate further, you ask? Does that mean we jump straight to painful biopsies? Not anymore. Thanks to modern medicine, we don't jump straight into blind biopsies. We use a high-tech camera instead. Enter the prostate MRI. It is a completely painless scan that takes a highly detailed 3D picture of your prostate. The MRI looks deep inside the tissue. It searches for any dark, suspicious spots hiding inside that 60 cubic centimeters mass. If the MRI picture comes back clear, you save yourself from unnecessary and uncomfortable procedures. Science is pretty cool, right? Finally, the massive weight of cancer panic is lifted off your shoulders. You understand your body so much better now. So the cancer panic is gone. That is fantastic news. However, there is still one very real physical problem left. Your prostate is still 60 cubic centimeters. It is still the size of a lemon, and it is still squeezing your urethra shut. How do we fix this? Dr. Ben explains that managing a 60 cubic centimeters prostate starts with a few simple lifestyle tweaks. First rule, stop drinking fluids 2 hours before bed. If the tank is empty, it won't wake you up at 3 a.m. Second, limit caffeine and alcohol. These aren't just liquids, they are active bladder irritants. They make your bladder sensitive and twitchy, squeezing out urine even when it is not full yet. Not fun. If lifestyle changes aren't enough, we use medication. First up, alpha blockers. Think of these as a muscle massage. They don't shrink the 60 cubic centimeters prostate, but they relax the smooth muscles around it. The grip loosens and urine flows freely. If we actually need to shrink the 60 cubic centimeters prostate down, we use a different medicine class called 5-ARIs. Normally, a hormone called DHT acts like a crazy bodybuilder, constantly pumping up your prostate cells, making it grow. The 5-ARI medicine acts like a giant bouncer at the club door. It completely blocks the DHT bodybuilders from entering. Without that constant hormone fuel, your 60 cubic centimeters prostate slowly begins to shrink over time, perhaps down to 40 or 45 cubic centimeters. That small reduction in size is often all it takes to take the pressure off the urethra completely. The pipes are clear. And the best part? It is 3 a.m. again, but this time, you are fast asleep, dreaming peacefully. By combining lifestyle changes with the right medical guidance, a 60 cubic centimeters prostate is highly manageable. But what if time goes by and the pills just aren't doing the trick anymore? Or what if the side effects bother you? Sometimes, that 60 cubic centimeters prostate is just too stubborn. It refuses to shrink and completely blocks the pipe. That is when Dr. Ben opens up his toolbox of modern, minimally invasive procedures to physically clear the way. Option 1 is the classic gold standard, TRP. This stands for transurethral resection of the prostate. Don't let the long name scare you. It is exactly like using a special tool to core the center out of an apple. The doctor gently shaves away the inner tissue blocking the pipe. The outer prostate remains, but the tunnel is wide open. Option 2 sounds like it belongs in a sci-fi movie, laser therapy, like HOLEP or Greenlight. Instead of scraping, a high-tech laser precisely vaporizes the obstructive tissue, literally melting away the blockage. Option 3 is incredibly gentle, RESM. This uses the natural power of simple water vapor or steam. Tiny droplets of steam are injected into the bulky 60 cubic centimeters prostate. The heat safely shrinks the excess tissue over a few weeks. And option 4 requires no cutting or destroying tissue at all. It is called the UroLift system. Imagine your enlarged prostate as a set of heavy window curtains completely blocking the sunlight. UroLift uses tiny implants, like tiebacks, to simply pin those heavy curtains open, instantly restoring the flow. The point is, these are incredibly common, safe, and highly successful outpatient procedures. There is nothing to fear. You are no longer a victim of your symptoms. You have a menu of excellent options to take back control of your life. Even with all these options, one dark thought might still haunt you. Can my 60 cubic centimeters prostate eventually turn into cancer? Let's bust this myth right now. BPH does not turn into prostate cancer. They are two completely different diseases. To understand why, we need to look at the geography of your prostate. Think of it like a piece of fruit. The prostate has two main areas, the inner core, called the transition zone, and the outer crust, called the peripheral zone. Benign swelling, or BPH, almost exclusively happens in the inner core. That is why it pinches the urine tube so quickly. Prostate cancer, however, typically starts in the outer crust. It grows silently on the edge, far away from the tube. Because it's on the outside, early cancer usually causes absolutely zero bathroom symptoms. None. They also grow completely differently. BPH cells are completely normal, they just multiply slowly, like rings on a growing tree. Cancer cells are mutated and chaotic. They don't respect boundaries, growing aggressively like rogue weeds in a garden. So, if your enlarged prostate doesn't cause cancer, what does? Science points to three main culprits. Number 1. Age. The older you get, the higher your risk. It is simply a matter of cells aging and mutating over time. Number 2. Family history. If your father or brother had it, your risk doubles. Genetics, like BRCA mutations, play a huge role. Number 3. Demographics. For complex genetic reasons, African American men have a significantly higher risk of developing it. Notice what wasn't on that list? A 60 cubic centimeters prostate. Your BPH is just an annoying sign of getting older, nothing more. You've conquered the fear with facts. But there is one final, crucial step you must take to protect yourself long-term.
Yes, fantastic.
That final step is monitoring your PSA velocity. This simply means tracking how fast your PSA numbers rise over time. A slow, steady rise over the years matches a slowly growing 60 cubic centimeters BPH. But a sudden, sharp spike? That requires immediate checking. This is why getting your routine annual blood test is so critical. One single high number isn't a panic, but a trend tells a story. Arthur now schedules his yearly visit with zero anxiety. He knows exactly what is happening inside his body. To recap, yes, a 60 cubic centimeters prostate is large. The massive internal pressure squeezes those tiny PSA workers right into your blood, causing high numbers. And remember, simple things like bike rides, infections, or a recent doctor's exam can spike it further. High free PSA ratios and a clear MRI scan are your best tools to confirm it is just benign swelling, not a tumor. When you understand the science, the scary monster in the closet usually turns out to be nothing more than a harmless shadow. Arthur is back to enjoying his life. He manages his 60 cubic centimeters prostate, sleeps through the night, and rides his bike again. A quick reminder, this video is for educational purposes only. Always consult your doctor or urologist for professional medical advice. If this video helped ease your mind about your PSA levels, please hit that like button so it can reach others who are worried. Don't forget to subscribe and ring the bell for more easy-to-understand, doodle-animated medical science every week. Know a friend or family member who is stressing over their prostate results? Send this video their way. You might just make their day. Thanks for watching, and as always, stay curious, stay informed, and stay healthy. See you in the next one. Silence.